Gail Klein Garlove was a Louisville woman known for her friendly smile, generous nature, and volunteer spirit. Tragically, her life was cut short by colon cancer ahead of her 55th birthday. But Gail's loved ones vowed that Gail and the goodness she represented would not be forgotten, which led to a lecture series.
Who could have foreseen that out of the tragedy of this young woman's death and her family's trauma, that something this exciting and positive could happen?
Medical oncologist Dr. Tom Woodcock cared for Gail through her colon cancer journey at Norton Cancer Institute. And when her family wanted to honor her memory in a special way, Dr. Woodcock stepped up in 1995 as the founding physician of the Garlove Lectureship.
It's important to understand that the lectureship was different. This wasn't just having some traveling expert come to Louisville with a box of slides. They were interested in trying to raise knowledge, not just in the professional community, but in the community at large.
It's because of the Garlove family's generous contributions through the Norton Healthcare Foundation that Norton Cancer Institute has been able to provide for decades this free annual educational event for medical professionals and the public. As the Garlove family continues to grow, so does the lectureship it started so many years ago.
I remember when it first started, we were at the Norton Hospital downtown, and it was in an auditorium, and there were probably 20 people there the first evening, and most of those people were there because Dr. Woodcock went out into the hallway and said, "We're having a lectureship tonight, will you please come?"
Each year, the event attracts hundreds of people from across the community, from doctors to patients to community members, as they listen to and learn from nationally recognized physicians about the latest and most innovative cancer treatments.
Early on, we had so many people that were struggling with cancer. They were in treatment. They wanted to find out what options they had. And so being able to give them that information at a level that they could understand, as far as, does this relate to your specific type of cancer? And are you a candidate for this? Rather than which chemical tracer they're looking to track. You know, it's good to have that information, but it's also good to know, how does this directly impact me as I'm struggling to deal with cancer?
Fighting cancer takes a village. This event aims to empower the whole community through education, because everyone deserves to be armed with knowledge, especially when it comes to one's health.
I think the lectureship is such a great example of that, of bringing the clinical world together with the community and saying, look, we're in this together. It's no different than our care model. And it's really beautiful to see.